Hey guys, I hope you can hear me.
Yeah, Monish.
Yeah, hi sir, how are you?
Okay.
Can you hear me?
I'm fine. So let's start now.
Yeah, can you hear me?
Yes, yes, very clearly.
Sure, sure. So, yes, with me we have
How are
Dr.
you, Vida? All
Pardawala
well?
from Saifee Hospital. So, he gonna tell us some more details on COVID pandemic and where we stand now and what is the future ahead. So, yes, Mr.
We are
Pardawala, can
starting
you?
already. We are
We have
starting
started.
already.
Yes.
Okay. See, hi friends. See, right now in Mumbai, at least where I am practicing at Saifee Hospital, the situation is really very fluid. Almost in my consulting, if I am getting 10 patients, out of that, 5 to 6 are strong COVID suspects. You can imagine this is a situation with me. Like this, there are millions of people in Mumbai. My personal observation is that what we are getting a figure in Mumbai of somewhere about 30,000 cases.
Okay.
There is a rule in virology. This is not applicable only for COVID, but every viral infection. That
Mhm.
if you pick up one case of viral infection positive, it
Okay.
means there are 1,000 cases who are undiagnosed. For
Okay.
one cases where you pick up positive, there are 1,000 cases who are undiagnosed. So you can imagine if you apply this formula, and I feel that must be in lakhs of people are who are already infected with COVID in Mumbai, at least I'm talking of. So the thing is, the best part about it is 80% of these patients can be managed very simply at home just by
Okay.
doing, just give them a proper hydration, give them a proper guidance, just take simple medicines like paracetamol and anti-nausea drugs and acidity drugs, and have, because they get a lot of, almost what I have observed in Bombay, at least almost 70 to 80% patients, they have severe nausea, vomiting, and
Okay.
loss of taste. It's very, very important. Because of that, they go into dehydration, and already a summer months. So dehydration is a very important factor. So just hydrate them well. Not necessary. It should be warm water. If it is warm water, is very good. But that's the most important thing is just warm water. A lot of water should be taken. And paracetamol and simple treatment is more than enough for almost 80% of the patients. Now, remaining 20%, especially those who are elderly and those who are suffering from diabetes, blood pressure, heart problem, kidney transplant, and those who are, post chemotherapy, cancer patients, kidney failure patients, they are in real trouble. For them, they need hospitalization
Mhm.
because their chances are very high that they will end up with the most common problem which we are facing, that is effect on the lungs, and they usually come with a very low sugar. The most important thing which I feel every family member should have is pulse oximeter. You don't require anything else, just a pulse oximeter which is available on Amazon. It just costs you 2,000 rupees. Keep on checking everybody's saturation level. If it drops less than 90%, then you should be very cautious. You need a doctor's assistance, because when these patients, they can come only with just weakness, nothing else. They don't have even any symptoms of hypoxia. That's why the new term has been coined. It is called as happy hypoxia. Means person is not suffering as such how we other patients they react. These patients do not throw away all the symptoms. They are called as happy hypoxia. So only when situation drops a lot, they start feeling breathless. So in that case, once you start searching for the beds, it becomes too late, and sometimes patient may die before you get any beds. Now, fortunately, now government has decided that all less severe cases and those who are not very symptomatic should be discharged as early as possible, because those who are asymptomatic, they are in the hospital and occupying the beds, and those who are really need hospitalization, they are roaming from one pillar to another. What happens is what we have seen practically is when you tell such patients to go home, they don't want to go home because they are feared of two things. Some of their anxiety is correct also because these patients usually they become serious from day 8 to day 14. But you
Okay.
can't keep all the patients for 14 days. If you start keeping all the patients for 14 days, then there'll be no beds available for any serious patients.
Sir, sorry to
So this
interrupt
is,
you. I have a
yeah,
few questions lined up.
yeah,
We can
yeah,
take one or two
sure,
and then we'll again start. So,
yeah.
if one become COVID positive, generally it creates a panic in the person as well as in the family. So, if you can give us some background of what is the mortality rate and how many out of
Sure.
100 are symptomatic to severe as well as less mild, or how they become critical?
Yeah. As I told earlier, that almost 80% of the patients, they
Okay.
won't get, even sometimes you will not come to know that you have suffered from COVID. Only when antibody tests will be available, which will be very soon, then only you
Okay.
come to know that, oh my God, you have already suffered from COVID because
Okay.
you may just get simple myalgia, simple body ache, tiredness, fatigue, that's all.
Yes. Yes. Okay.
This is going to happen with almost 80% of the patients. So you will not even come to know that you have suffered from COVID. Now problem comes only in 20% of population where they are really symptomatic. They get
Mhm.
a lot of fever, high grade fever, maybe 100 and
Okay.
above. They get a lot of fatigue. They get nausea and vomiting. The problem
Mhm.
starts with the last 5% patients who start getting breathlessness. And that is a
Okay.
time when hospitalization and most important, those who say that there is no treatment for COVID is wrong. I say
Okay.
by spreading such kind of myths is a wrong thing. There is, see, for all viral infections, bearing few, there are hardly any drugs available for viral infections. Say,
Correct.
for
Correct.
example, HIV, there is a drug, herpes, there is a drug, but for most of the virus, there is no drug. But symptomatic treatment itself is very helpful, very useful. Say, for example, when a patient who becomes breathless, okay, so
Okay.
what we do in the hospital, the most important treatment is oxygen. And there are various ways of giving oxygen. First, we always start with nasal oxygen. If
Okay.
your situation comes up with that, well and good. If it does not come, then we give high flow oxygen. Means we give very high concentration of oxygen. And we always tell such patients to lie down on abdomen. Means it is called as
Okay.
prone position. So I will recommend all those who got patients at home, they should
Okay.
allow such patient to lie down only on abdomen. Means prone position they
Okay.
should lie down. By just
Okay.
doing this, you can avoid lot of hypoxia and less sugar, less oxygen.
Okay.
And only 5% of these serious patients they require ventilator support.
Okay.
And the other medication which has been found to be very useful in these patients is low molecular weight heparin. That is in short term, it is called as blood thinners. They are
Okay.
really saving so many lives because it has been found that this virus causes a problem in the blood where your blood becomes thick. So your blood gets clot anywhere. It may be in the lungs, it may be in the brain, eyes, kidney, and the limbs, anywhere. So blood
Okay.
thinners are also very useful.
Mhm.
And only in those patients who oxygen doesn't come up and they go in shock, there one new drug is there which is called as rosizulamab, which is very costly. It is 40,000 rupees per injection, but it gives wonderful results in such patients. And patient requires usually one injection. Sometimes there may be two injections. So to say that there's no treatment is not correct.
Okay. So there is a treatment going on in every case
Yeah,
in
that's
every
how we are
hospital.
saying
Yeah.
so many patients. Yeah.
Okay. Okay. So, what can we do to boost immunity? So, like, what kind of we can do?
So to be honest, what immunity you have cannot be generated in a day or two.
Correct.
It
That's
is
true.
a years of hard work, and
Mhm.
it depends on your immunity depends on multiple factors. And the
Okay.
most important thing is what you eat, number one. Number two, what kind of physical activities you have.
Okay.
Number three, how much rest you take, whether do you get adequate sleep or not. Number
Okay.
four, your genetics, means what
Yeah.
kind of genes you have got. These
That's more important.
That's very, very important. After that comes other factors like what kind of medical problems you have. Then comes what kind of medicines you are on. And then comes
Okay.
what kind of environment you are living. So these are multiple factors which decide what is your immunity level.
All right.
Just here I would like to add something which is very interesting. Recently somebody asked me why the death
Okay.
rate was so high in Europe and US and why it is
Okay.
not so high in India. The
Okay.
answer is very simple, which
Hmm.
you should understand that why our death rate is really low. The reason is, you know, our bodies, our environment is full of infections.
Correct.
So all of us, we are exposed to so many kinds of viruses and bacteria throughout our life, day and night. So our
Correct.
immune system is always in a combat mode. Means it is just behaves like Israel army,
Okay.
always ready in a combat mode. So any little incursion, it reacts.
All right.
While what happened in US and Europe, because they live in a very clean and good environment and follow a good hygiene, their immune system was not ready. So
Correct.
it was not combat prepared. So for them, this virus caused havoc.
Yeah, because
So here,
if you look at the statistics, also in Europe and US is most affected.
while Asia and Africa death rate is not so high, this
Yeah.
is the reason. This is the reason. It is called as innate immunity. Innate immunity means
Okay.
your immune system is already tuned for such kind of attacks.
Okay.
But in general, if you want to improve from today onwards, then your
Yes.
diet should have a combination of four things. You should have
Okay.
enough proteins.
Okay.
Proteins is very, very essential. Unfortunately, our Indian diets are full of carbohydrates and less of protein, especially so in vegetarians. So a good amount of proteins is very important, number one. Number
Okay.
two, vitamins. There are two kinds of vitamins, water soluble and fat soluble. So
Okay.
fat soluble vitamins will come from dairy products and all,
Okay.
and water soluble vitamins will come from fruits.
All right.
So enough fresh fruits is a must. And the last thing which is very, very important is trace elements. Because for immunity, trace elements like magnesium, zinc, selenium, copper, they are also very important. And unfortunately, they are very poor in our diets because
Yeah.
these trace elements are found only in seeds of any kind, like dry fruits or any seeds, pumpkin seeds, all seeds. They are full
Okay.
of trace elements. So if you see the Arabs always have, if you go to any Arab country, there are big shops are there with lots of variety of seeds available. That's the beauty of their diet. They eat lot
Yeah.
of seeds. So if you want to improve your immunity, eat lot of seeds, at
All
least
all
daily,
right.
some 50 grams a day.
Okay. Another question was from a follower is how should we take care while you are in office? Like, do we have to wear mask and glove full time? How do we keep our office table clean? How frequently we should keep our table clean and all?
Yeah. See, when the epidemic started, we were told that there are three ways by which you can contract a virus. Number one,
Okay.
through air droplets, means
All
somebody
right.
who is coughing or
Okay.
sneezing
Okay.
or say is talking with you in a loud voice, then this virus gets transmitted to your mouth and nose. That was the first
Correct.
mode of
First
transmission.
mode of transport.
First mode of transmission. Second
Correct.
was if you come in touch with a object or a surface where somebody has coughed or sneezed or something, and the virus
Okay.
lies down over there and it remains alive for a few hours. And if you touch the surface, and after touching the surface, if you put your finger in your nose or mouth, virus may get transmitted to the your body. And the
Okay.
third, which was very rare, but it was a fear that somebody was going to use a toilet washroom, and because it was fear that this virus is transmitted in urine and stool also.
Okay.
Even in semen, it has been found that virus was found. So that
Okay.
was the third mode, that if you go and use that same commode, you may get the infection. But
Okay.
very recently, say about 4 5 days back, CDC has done a very nice study and they have found that among these three, only the first is very important, and that is
Mhm.
airborne infection. It is an
All
airborne
right.
infection which transmits from mouth to mouth. So
Okay.
contact touching and other things
Mhm.
are not very important. Now,
Okay.
as far as mask is concerned, there are
Mhm.
certain things which you should know very well because you are going to use these masks for maybe 1 year or 2 years. So there are certain facts which you should know.
Okay.
Like when you wear a mask, you are wearing for the other person. You are not wearing for yourself.
Okay.
Because by wearing mask, you are not protecting yourself. You are protecting others. Because
Others.
when you are wearing a mask, when you cough and sneeze, the most number of viruses will be trapped in that mask, so others are protected. This I am talking of an ordinary mask, like surgical mask or ordinary mask, which we are recommending
So
nowadays.
the mask can
So
be reused or it's like disposable
first,
mask.
let me finish. Let me
Okay.
first finish this mask. So
Okay.
one is the ordinary mask which you are using from homemade or say surgical mask, right? But when you
Yes.
use a N95 mask or a
Okay.
Swiss mask, which is now available, so N95 mask protects you also and protects others also.
All right.
And Swiss mask, there is another mask which is available in the market,
Mhm.
which is very costly. It's called a Swiss mask.
Okay.
This Swiss mask can be reused, can be washed, can be used for 120 days.
All right.
But the N95 mask, it depends on which environment you are using, how much
Okay.
is the humidity, and if it gets spoiled from inside or it gets weight from inside, then you have to let it dry for 24 to 48 hours and then you can reuse. But as
Okay.
far as
Okay.
ordinary or cloth masks are concerned,
Mhm.
you should
Mhm.
wash them daily and keep a
Okay.
2 3 pairs so you can
Mhm.
keep on reusing every second or
Yeah, we
third
can
day.
reuse that.
Yes, yes. You wash
Yeah. Yeah.
it properly with soap
Okay.
and liquid, and then you
Okay.
can reuse. But surgical mask cannot be reused again.
Okay. Got it. There is another question from Pooja asking, don't you think that overusing the disinfectant may cause long-term harm?
Very true. That's why I said that people have become now paranoid and phobic about all these things. So, if at all, if you want to clean your tables or your, whatever surfaces, just you need
Okay.
to clean 2 or max 2 to 3 times in a day. That's all.
All right.
Not keep on
Okay.
cleaning every hour or after every person who comes and you keep on cleaning because these are all chemicals which can vaporized and may create a lot of respiratory problem, even eyes problem. You get a lot of irritation in the eyes, nose. So just you need to
Okay.
wipe only 2 or 3 times in a day.
All right. Not many frequent, not much more than 3 or 4 times. It will create
Two to three times.
problems.
Once you sit on the table, that time you clean it. Once on a halfway
Mhm.
you do it, and when you are leaving that office, that time you clean it. That's all.
Okay. And there are another question like there was one homeopathy medicine which is approved by Ayush and they have started distributing in many districts and Thane city also in our. So how far is it the effectiveness or should we take that or what is your take on that?
See, what happens is whenever allopathy says, sorry, we don't have medicine, then there are many alternative medicines are there, branches are there who claim that we have medicine.
Mhm.
Unfortunately, none of these products have ever carried out any proper study. See, I may claim anything, but it has
Correct.
to be confirmed.
Confirm.
So none of these things have been confirmed that yes, they are effective. So you use, it's up to you. But there are
All
no
right.
proofs as such. There are no proofs as such. No scientific studies are available that really they are
All right.
effective.
Okay. Second question was whenever we get fruits and vegetables from outside, so or any box of packages outside, so how do we clean it
Go
and how
ahead.
do we
Yeah.
keep it? Yeah.
See, it's always otherwise also. Forget about COVID. You know the situation of our fruit, how it is transported. If you see throughout the journey, from farmhouse it goes to a lorry, from a lorry it goes to the wholesale market, and what
Correct.
terrible conditions these wholesale markets. You just go once and see there. Then it comes to the semi-retailer, and then from semi-retailer to the retailer, and then it comes to your house. It is not only COVID, otherwise also lots of other like typhoid, like jaundice bacteria, viruses, like various kinds of worms, all can be contaminated on these fruits. So it's always better, otherwise also, to wash
Mhm.
these fruits very nicely in a deep water for some time and individually clean them and then you keep in the freeze. Don't put them directly or don't eat them directly. It is always otherwise also very helpful. As far as packed fruits, food packs are concerned, you can wash
Okay.
them wherever
Okay.
possible. It's always better idea. Not for COVID, but otherwise also.
All right. So since COVID, we don't have so vaccine right now. So like, do we have to like the government had already started uh, domestic airlines. Also, they are giving permission to many businesses to start. So, is it we have to live with COVID just like any other disease like TB or
Yes,
malaria? We don't have. We have to
very
live with COVID
correct.
now.
See, there are three scenarios. Number one, which is the most likely, number one, that any vaccine usually takes years, not 1 year or 2 year. Like till now, if you see whatever vaccines have come for any disease, they have come in 10 years, 15 years time.
Okay.
Okay. So by that time, the whole population is already infected and vaccine is not required. And
Okay.
then it is unnecessarily pushed to the market. So what you get is called as herd immunity. Means, as
Okay.
I told you, that one confirmed case means there are 1,000 unconfirmed cases. So before these vaccines will come in 1 year, almost 60 to 80% of population of the world will be already infected. So your body has already developed antibodies.
Okay.
And then the vaccine will come and they push you and force you have to take it. So this is the most likely scenario that all
Mhm.
of us has to suffer to get the immunity.
All
Now,
right.
second scenario, that when a vaccine comes, hope so, maybe in a year or two. Remember, these viruses, they keep on changing their structures
Okay.
to that extent that till now, in 6 months, there are 80 variant types of already COVID viruses are there in the market, in the environment.
Okay.
So when you create a vaccine, it works against two or three variants, not more than that. So even if vaccine comes, it will provide you protection against two or three variants.
For
So
example,
you
you mean to say one virus we are creating a vaccine may not work for after 6 months or 8 months.
yeah, like in a flu vaccine, every year a new vaccine comes. Every year there is a new vaccine coming. Same way will happen here that every year there will be new vaccine which will be available. So vaccine will be useful in only high risk patients, not for general public.
All right.
So once vaccine comes, it will be applicable only for high risk patients.
So this will be the new normal routine
Way
we
of
need to
life.
develop. Yeah,
Yes.
way of life.
Yes. Gradually all, and I'm seeing the change now in Bombay. I'm seeing the change. How in the past I used to say, if you tell some family member that looks like COVID, they'll be in a great shock. Now they are not in shock at all. They say, okay, no
Okay.
problem, doctor, we'll take care at home. So
Okay.
already the change has come. Already change has come in environment. It has been accepted. Yes, we all are going to get infected, and
So
they
you
are not
think
very shocked.
with many other diseases will be in control like TB or malaria?
Sorry, I could not get.
Do you think due to COVID, any other disease which are like TB is on higher risk in Mumbai or India, so will be in control because of this?
See, there will be some benefits and disadvantage of any situation. If people start using mask, the spread of TB will become less. You got it?
Okay.
Because people will be using masks. So because TB is also highly contagious disease, it spreads from one person to another. So if everybody is using mask, the TB patient also will be using mask.
Yeah.
So in future, in 8 to 10 years, you will find the incidence of TB will come down drastically in India
Okay.
if we are using masks. So it will be indirect parallel advantage of this wearing a mask.
Mask.
But right now, other diseases are really suffering. We
Okay.
get patients like TB patients. Some of them are not getting medicines, though they're getting from government hospital. They're getting treatment. Now nobody entertains them. So all of them are having real tough time to manage their diseases because of COVID. Because of a whole concentration is now only COVID, 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 and COVID.
All right. So thank you so much, Dr. Pardawala, for your information and great insights and how to keep us on this COVID scenario and future ahead. Thank you so much.
Most welcome. Anytime you can call me. Okay.
Yes,
Bye. See
yes,
you.
sure.
Thank you,
Thank you
viewers.
so much. Yeah,
How can I get this program on my? It will be there on your
sure,
this thing, no
sure.
accounts.
Will be there. I will send you.
Okay. Thank
Thank
you.
you so much.
Bye, sir.